listen-only mode.
Oh, what's happening?
Good afternoon,
no.
everybody. We're
I'm not
live.
hearing anything. I see Pip is talking, but I don't hear anything. What the heck is going on?
Hello, can you hear me?
Hello,
Yes, I can hear you, Pip.
Okay.
Can you hear us?
Okay, yes, I can hear you.
Good afternoon. Hearing anybody. I'm not hearing anybody. What's going on?
Hold on, is that Bev talking?
No, that was Melissa.
Oh, Melissa. Well, Melissa, I'm just going to put you on mute so that we can start the webinar and introduce everybody, and then we'll figure out what's going on. Well, good afternoon, everybody. Sorry about that little technical glitch. Welcome and thank you for joining us for our webinar presentation today. During this webinar, our speakers will highlight the tools and resources available to support families by walking you through two of Family Voices project websites. You'll learn about the resources developed by the Kids as Self-Advocates program, also known as CASA, the partnering tip sheets, ACA, Affordable Healthcare webpage, monthly blogs, and the Bright Futures Pocket Guide, and many other resources that are available to you for your to families, family leaders, and other professionals helping support those families with children with special healthcare needs. Let me just move the slides forward here. So before I introduce our guest speakers, I'd like to tell you a little bit about Family Voices of California and our lunchtime webinars. These presentations are typically statewide and sometimes, like today, nationwide trainings on health and policy topics which affect children and youth with special healthcare needs. Our webinars are geared towards diverse groups, which include families, professionals, parent-to-parent resource staff, providers, and advocates. Family Voices is a statewide coalition of locally based parent-run centres working to make sure children and youth with special healthcare needs receive quality healthcare. And as the state affiliate of the National Family Voices, we are California's federally funded family-to-family health information centre providing statewide support to families of children with special healthcare needs. So a few notes about the technology that we're using today. If you don't have a headset for your computer, you can join us by telephone by dialing into the number that you see on your attendee screen panel. And if you have any technical difficulties, please call GoToWebinar directly at 1-800-263-6317. And owing to feedback issues, we do have everybody on mute from our end until we open it up for questions. So throughout the webinar, please feel free to type any questions that you might have in the questions box down on the right-hand side menu, and I will also try and unmute you so you can speak to us directly. Today's presentation is going to be recorded and will be posted on our Family Voices of California website, as well as the National Family Voices website. You can actually access our archived webinars anytime from our website, and after the presentation today, you will be emailed a very short survey to evaluate today's webinar. Please take the time to give us your feedback. It really is invaluable to us. So now it is my pleasure to introduce our three presenters. Bev Baker. Bev is the co-director of National Center for Family Professional Partnerships, also known as NCFPP. And Peggy Curran is the Family Voices IT and Design Coordinator. Melissa Vickers is Family Voices Project Coordinator. So I'm now going to pass the presenter role over to Peggy, and I thank the three of you for joining us today to present. So here it is for you, Peggy. Over to your screen. Can you see that? Great.
Yep. Thank you. Okay, welcome everyone, and thank you, Pip. This is Bev Baker. I'm going to start us off. Welcome to this webinar. As Pip introduced, I'm Bev Baker, and 2 years ago I was hired as the co-director for the National Center for Family Professional Partnership, which is a project of Family Voices. I came to this role from, prior to this, I served as the as the Family Support Director of Family Health Information Center in the state of Maine. And I got involved in this work after the birth of my second child. My son, who is now 21, has a diagnosis in the autism spectrum, and right now he is just very recently transitioned into his own apartment in a small city in Maine, a couple hours away from us. So I'm going to share a little bit with you today about what you can expect. So we'll start by providing a brief history of the organization, describe the work that we do, share some of the tools and resources that we have developed to help family leaders grow and to improve systems of care of children and youth with special health care needs, and finally to increase the ability of families and professionals to partner, a big focus of the National Center. Following the slide presentation, we'll provide a tour of three of our websites. We've added an additional website tour in. We also have available for download a list of resources presented on today's slides. I think actually Pip is going to send those out following the webinar. Next slide, please. Family Voices is a national family-run nonprofit. It was founded in 1992 by families of children and youth with special health care needs. And it was created specifically to activate family roles in healthcare. The mission of Family Voices, as shown on this slide, is to achieve family-centered care for all children and youth with special health care needs and/or disabilities. Through this grassroots network, we're able to provide families with resources and support to make informed decisions. We help advocate for improved public and private policies. We work at building partnerships between families and professionals. And we serve as a trusted resource on health care to both family leaders and our professional partners. We hope that in this webinar, we will share some opportunities and resources that will be particularly helpful to you. Next slide, please. This grassroots network of family leaders from across the country, which they had been meeting and working to effect change, but formally came together in 1992 to form this Family Voices organization that exists today. As you'll see on the map there, our staff, consultants, and board members are spread across the United States. So the red hearts that you see indicate where we have staff, board, and consultants working and living. Our work is focused on connecting and supporting family leaders in every state. We now have family health information centers in all 50 states and in the District of Columbia. And we have Family Voices state affiliate organizations in 44 states across the country. And as you heard in Pip's introduction, Family Voices of California serves as both the state affiliate organization for the National Family Voices and has the Family Health Information Center funding. Our work includes connecting and supporting youth leaders through Kids of Self-Advocates, known as CASA. I'll share a bit more about this project later on in the webinar. Our work includes collaborating with a variety of partners to promote family-centered care. And our policy team in DC monitors legislation and helps families advocate for policies that support the complex needs that our families raising children and youth with special health care needs often encounter. The map on this slide provides the numbers of families with children and youth with special health care needs in each state and identifies by color the states where the F2F and the SAO are co-located. So those are the states that are colored yellow, which are the majority of the states. It also shows where the organizations exist separately, colored in the green there. And as I mentioned, the red hearts indicate states where our staff and board reside. Next slide, please. Our tools and resources are developed for family leaders, families, and professionals. We disseminate these tools in a variety of ways. We have 4 websites. We'll be giving you a tour of a couple of those, 3 of those. We have private portals, multiple listservs, newsletters, and social media. With most information, well, most of it's available to the public. We do have a few items that that family leaders that we shared just with our family leaders because of the grant that we serve them through. If you are a Family Health Information Center staff or a Family Voices State Affiliate staff, you can learn more about the resources posted on the private portals from your project director, or you may contact Peggy Curran directly. Family Voices is a membership organization that offers 3 types of membership: individual, organization, and what I was talking about earlier, the state affiliate organization. When you join Family Voices, you provide a much-needed support for education, advocacy, and technical assistance to children and youth with special health care needs and disabilities across the country. It's our members who contribute to this collective effort of keeping families at the center of children's health care. As a member, you'll receive benefits such as discounts on some of these materials we'll be sharing with you today, early notification of events, inclusion in Family Voices Talk, which is a members-only listserv, and representation and advocacy at the state and federal levels around issues that you care about. To get the specifics about membership and the benefits associated with each type of membership category, please visit our website. That would be the Family Voices website at www.familyvoices.org. I'm going to turn this over to Peggy Curran to share some specific resources.
Great. Can you hear me okay?
Yes.
This is Peggy Curran, and my current title at Family Voices is IT and Design Coordinator. I've held various positions at Family Voices for the past almost 14 years. And I am the parent of 3 adults now. My youngest has special health care needs. And I just can't help but thinking that our work as moms and dads and as advocates never stops. That today, while preparing for this PowerPoint, I was also preparing a letter to read at a hearing coming up tomorrow night due to the fact that my daughter is now being told that any more than 5 people in a home is considered an institution, and we're going back to the battlegrounds again. But I guess, like I say, it never ends. Anyhow, that's my personal spiel. I'm glad you could join today, and at this point in the presentation, we're going to talk about some specific tools and resources, and we're going to talk about them by topic area and also try to help you think about whether the target is really family leaders, families, or professionals. The first slide here, we're talking about family leadership. The foundation of Family Voices is a network of family leadership across the country. Through the NCFPP Cooperative Agreement, our goal is to increase the capacity of family leaders to assist families and partner with professionals. This is done through materials, trainings, and peer-to-peer connections. Highlighted below, you'll see the FIPS reports. These are the Families and Program and Policy reports for the CYSHCN and MCH programs. These were interviews with program directors and families specifically about family involvement in Title V. And while these reports are over 10 years old, they do provide valuable information about the professional and family perspective on how families participate, the extent of their involvement, the benefits of family involvement, the areas in which families contribute, obstacles to family involvement, and family involvement in the block grant process. We've also highlighted just below the FIPS report the fiscal year 2014 activities and accomplishments of Family-to-Family Health Information Center. This is a report, and it provides a state-by-state look at each F2F center. Included are highlighted activities as well as state-specific data on outreach, impact, partnerships, involvement in specific initiatives, as well as a family story. We hope this book is useful to you to get ideas about what your other peers are doing across the country. In the middle of this slide, you'll see the Power of Partnerships program book. Family Voices provides trainings for staff at family-to-family centers and state affiliate organizations as well as the public. This program book would provide you with a glimpse at the workshops we offered at a family leader meeting held this past spring in Washington, D.C. for over 120 participants. Another way we provide family leadership resources to family leaders and others is through our newsletters. We have 4 newsletters, and shown here is the Friday's Child newsletter, which is a quarterly newsletter offering articles and resources for existing and emerging family leaders as well as professionals on such topics as leadership, mentoring, and partnering. And I think, Melissa, will you introduce yourself and talk about the focus group toolkit?
Sure. Can you hear me?
We can, Melissa.
Okay, great. Okay, I was having problems before. Okay, hi, I'm Melissa Vickers. I've been the Impact Project Coordinator. Impact stands for Improving Maternal Child Health Policy So All Children Thrive. I'm currently working with some other FE projects, including the National Center and the CAMI project, the Child and Adolescent Health Measurement Institute. I came into Family Voices in 1998 as a parent reviewer for Title V block grants, and over the years have been doing various things as consultant, and I'm currently on staff and love it. I'm the mother of 2 adult, happily married children and the grandmother of an adorable 16-month-old grandson. Talk a little bit about the focus group toolkit. The Impact Project's Health and Wellness Initiative was built around gathering family wisdom about health and wellness, the things that families do and the barriers they face. We used focus groups led by trained family facilitators to solicit input from families in the 6 states involved in the project. And we created a toolkit of forms and helpful tips used during and learned from our Health and Wellness Initiative to make it easier for others wishing to conduct family focus groups. Next slide. Okay, while family leaders at Family to Family Centers and Family Voices state affiliate organizations are on the ground providing assistance to families, we also work to increase the capacity of families to both partner in decision making and develop leadership skills. Some of the ways we do this are through the following. First, in the center in the little purpley blue book is the Getting to Know Title V booklet. This is a popular little booklet, and it was recently revised with input from the Maternal and Child Health Bureau. It has an overview of MCHB, its history, the Title V program, and how families can be a part of the process of identifying statewide priorities and evaluating progress towards achieving them. Over on the left-hand side, you'll see partnering tip sheets. Family Voices has developed 2 6-page tip sheets based on the experiences of other families, including partnering with your child's provider and partnering with your child's health plan. The latter is an outline of questions to engage staff at a health plan on their policies and programs for children with special health care needs. Then in the center is You Are an Advocate. This tip sheet notes that the sooner we become advocates, informed, strong voices for our children, the smoother life becomes for our child and family. You can use these tips with your child's doctor, hospital, clinic, therapist, preschool, child care center, classroom, community, and with extended family and neighbors. It's an all-purpose toolkit. And then in the lower right-hand corner, you see the Care Notebook. The network of family leaders frequently shares materials with each other for the benefit of families in other states. This guideline, developed by Utah Family Voices, is a collection of over 45 forms from family leaders across the country that can help a family track and communicate about the needs and services of their child, such as an emergency health information sheet, diet tracking form, activities of daily living, and more. And then also the National Center sends out short emails periodically to provide links to current information and new resources targeted for families of children with special health care needs. And I'll turn it back over to Deb. Thanks.
Thank you, Melissa. Just as families often find that the best help they receive is from other families, youth also find critical support and information from other youth. Family Voices helps bring together youth to share information to increase knowledge around a variety of issues and to help healthcare professionals, policymakers, and other adults understand what it's like to live their lives and how to help each other succeed. Kids with Self-Advocates, also known as CASA, is a national grassroots project created by youth with disabilities for other youth. CASA was developed to help youth increase their capacity to partner in decision-making and to develop the leadership skills of youth. An advisory board made up of teens and young adults with disabilities guides this work. The basic premise that CASA operates from is that youth can make choices and advocate for themselves if they have the information and support that they need to do that. So in order to meet these goals, CASA board members have created an array of tip sheets to assist youth. Displayed on this slide, you'll see the newly created tip sheets, tips for flying, I guess you can read those, tips for flying, attending college, and online dating. On the website tour, we'll have a chance to see the broader array of topics that are covered in tip sheets and other informational guides. Other resources shown on this slide: how to be involved in a border council, roles and responsibility. This is a 4-page pocket guide that provides information for youth interested in getting more involved in their community. Also displayed here is the Paraprofessional Toolkit, tips for helping a student successfully work with a one-to-one aide in school. These resources are available for purchase through the Family Voices website and download on the CASA website. The CASA project is currently going through a transition. So while we're seeking to hire new leadership, we're exploring opportunities to work with state-based youth groups across the country and plans to reinvigorate our listserv and social media outlet. We'll keep you updated on the CASA website and send listserv messages to keep you posted on new developments and opportunities as they come about. So back to Peggy.
Actually, Bev, can you hear me?
Yeah.
I have a question about CASA. Someone has sent in a question. It says, we know of teens and young adults locally in the western states who are really interested in joining CASA. How can they be actively involved? Do they use social media? Do they have a Facebook? Maybe it's closed, but online discussion groups? You're saying it's going through a transition, but I'm wondering if there are currently youth and young adults out there who are interested, how would they get involved right now?
Well, right now, Pip, that's a good question. So right now, people should contact me. I'm serving as the temporary project director. What we're hoping to do, we do have a listserv. It's not active at the moment, so we're looking to reinvigorate that and to get some social media going. I'll have to let you know about what's coming, but in the short run, I'd be happy to hear from folks who are interested, and we'll, and then I can communicate directly with those people as well.
Okay, that's great. Thank you.
Mm-hmm.
Pip, is there any need to open it up for questions, or are we all set?
I don't have any others at this point.
Okay.
So let's keep going.
Great. Thank you. Another area that we focus on is the Affordable Care Act. Enrollment for health care coverage through state and federal exchanges has taken place during this first year, and a key focus of our NCFPP cooperative agreement has been to help families and others understand the complexities of this law. To that end, we've developed some of the following resources. First, you see the ACA Resource Center, excuse me. This is a place on the website where we provide information about the marketplace, resources to help families and assisters with enrollment, materials on obtaining coverage, specific medical/health issues, and Medicaid expansion. Part of the Resource Center is our calls and webinars page, where we provide up-to-date information about free webinars hosted by others on various aspects of the ACA. Our monthly blog is disseminated online as well as by tip sheet, and that's what you see over on the right. The blog postings provide relevant information for families of children with special health care needs and have included discussions on enrollment, provider network, immigrant coverage, changing circumstances, therapies, and oral health. Melissa, do you want to mention the ACA tip sheet you've developed?
Sure, thanks, Peggy. In the center, you'll see an impact resource that we created on health and wellness angles of the ACA, the preventive and health promotion things that families can do, and just things that are in the ACA that are relevant to health and wellness. Next slide. Speaking of health and wellness, helping families learn about health and wellness for all children, including those with special health care needs, has been the major focus of the Family Voices Impact Project. In recognition that even the child with the most severe health issues still benefits from good nutrition, oral health care, safety and injury prevention, etc., Family Voices has engaged with a number of partners focused on health and wellness, and we have many resources for families. Most of the resources includes information specific, at least in general terms, for children and youth with special health care needs, and a few of them are shown on this slide. First is the Bright Futures Family Pocket Guide, Raising Healthy Infants, Children, and Adolescents, and is now available in both English and Spanish. And this is built on the American Academy of Pediatrics Bright Futures Initiative and includes information by age and stage from birth to age 21, and by health promotion theme, nutrition, child development, mental health, etc. And it also includes more than 150 resources on a wide variety of topics important to families. Moving over to the right a little bit, see an example of the impact on health and wellness one-pagers. These are easy to read, family-friendly news about health and wellness, and again based on those health promotion themes from Bright Futures. And then the front center is Family Matters. This is a little booklet that's based on a research study with Family Voices and Tufts University that was done a few years ago. And has information on nutrition and physical activity, and specifically for families with children with special health care needs. And then on the far right, you can see some of the pieces from our Family Voices Flu Prevention Toolkit. Working with the Centers for Disease Control, Family Voices endeavored to help both families and providers understand the risks of flu for children with special needs. And these fact sheets in both English and Spanish, as well as a media toolkit, target that goal. And next slide, and back to Bev.
Oh, actually, Melissa, there's another question.
Okay.
While we're talking about those resources, which are really does Family Voices plan to translate them into other languages, Cantonese, Mandarin, Vietnamese?
I would absolutely love it if that could happen, but that's a project that's awaiting funding to happen. We were very fortunate to get the Pocket Guide translated into Spanish using a family leader from North Carolina, Monica Bernot. And, you know, it would be great to be able to translate those into other things, but right now we don't have the funding to do it. So
completely
I hope it happens.
Okay,
thank you. Okay, Beth?
Yes, thank you, Melissa. So keeping abreast of policy happenings and ensuring that the family voice is at the discussion table is a priority for Family Voices. Our DC policy team is a key component to ensure that this happens. The Washington Update, which is displayed here on this slide, it's an electronic newsletter that comes out weekly, and it's one way we keep our network of Title V leaders and families and other partners informed. We provide tools, resources, and updated information to our family leaders in order to assist them in sharing the issues with their members of Congress. On the right side of the slide, you see the News and Happenings section of the National Center website, where Family Voices shares news of key events for families and others, such as webinars, opportunities to comment, surveys, and listening sessions. Our policy team is available to accompany new family leaders making visits to the Hill while visiting D.C. Staff and other network members coach family leaders to do this work in their home state. We provide one-page state reports created from the data submitted by each of the health information centers that family leaders use to share their work with policymakers. These one-pagers describe the work of the family and highlight a key accomplishment that family has in their state. Back to you, Peggy.
Okay, thank you. Healthcare quality is a concept studied by researchers, but for families it means care that is family-centered, community-based, culturally competent, coordinated, and affordable. Family Voices has been a key partner in efforts to make quality of care a reality for families. The logo on the left is for the Family-Centered Care Assessment. The FCCA is a quality measurement questionnaire developed through an extensive process of in-person meetings, conference calls, and interviews with expert family leaders and healthcare providers. This new measure expands areas of quality measurement to important content areas in decision-making interactions, family support, community services, and cultural competence. It is currently being tested by family groups with pediatric practices and is available to the public through an application process. In the center, you will see our one-pager, Family-Centered Care from Theory to Practice. Developed specifically for families, this one-pager defines family-centered care, details evidence of the benefits of family-centered care, and provides guidelines in implementing family-centered care. To the right, you'll see our booklet, Growing Your Capacity to Engage Diverse Communities. This 20-page booklet provides information on identifying community liaisons and cultural brokers. It includes steps to forming collaborations and how to gain entry into communities. So that sums up our presentation of some selected resources for you. Again, we do have a handout that specifically provides the links to those resources. But we're also providing on this slide ways that you can connect with us. We list our 4 websites and our email addresses. And if there are no further questions, I think we'd just soon jump into our website tours. Is that okay, Pip?
Yes, I'm sorry, I had to unmute myself.
Yep.
Yes, no other questions. We're ready for the website tour. That would be great.
Okay. We're going to show you some areas of three of the websites that Family Voices has. The first is this website, the National Center for Family Professional Partnerships. On the right, you'll see a map of the United States, and these represent pages for each F2F across the country. And I'm going to click on Utah. And on each page, as you will see on the Utah page, there is contact information for that family-to-family center, information from their grant abstract. I scroll down, a highlighted activity that they're particularly pleased with, and also examples of shared resources. So on this page, you will see that collaborative care notebook that Melissa mentioned during our presentation. Going back to the home page, right below that map, you'll see a box for our newsletter signups, and these were mentioned during the presentation. These are e-newsletters, excuse me, but if you click on this link, you will also be able to see some archived versions, such as like the Washington, D.C. update. So if you don't get the e-version, you could come here and look at the version after it's been posted. To sign up for these newsletters, you simply put your email address in there and hit go. Other highlighted materials include the fiscal year 2013 F2F data report. We didn't mention this in the presentation, but it is an aggregation and summary and analysis of all the data submitted by each F2F across the country last year. And there you see below that a link to our partnering materials. Scrolling back up, the middle column shows some highlights that have particular relevancy to families and professionals, such as the announcement of the new funding for family-to-family centers. And by clicking on this link, you'll be able to get to the guidance, view the webinar recording, and find more information. Right below that, we're informing folks that open enrollment begins November 15th. And if you click there, you'll be able to get more resources to help families enroll. Looking over at the right column, we have our quick links box, and that provides easy access to frequently accessed materials that the NCSPP provides. And just below that, you will see the news and happenings column that was mentioned in the presentation, where we post information about webinars and other events that are key for people, such as the NCQA, who is currently seeking public comment from families about their experiences in practices that serve as medical homes. If you click on this, on any of these entries, you will get more information, including links to the original site and any materials that are needed to understand, what this posting is all about. This news feed is also available as an RSS. Now I'm just going to review some of our top menu items. We have more information about us, more information about family-to-family health information centers, including such things as past data reports, past meetings, and many of those meetings provide workshop materials that occurred during those meetings. One page I want to show you about specifically are pages that we have to help people learn about caring for children and youth with special health care needs. The impact on families on caring for children is significant, both financially and in terms of time required to care for kids. And what we've done here is pulled out some graphs from the Data Resource Center to help people understand what it's like. If you haven't visited the Data Resource Center, you really should. It's a great place where you can find easy-to-understand statistics and charts from surveys such as the National Survey with Children with Special Health Care Needs and the National Survey of Children's Health. Scrolling back up, we have sub-pages about various activities in which we've engaged with partners. Melissa had talked about the flu in children with special health care needs, and just recently we did a project with Prevent Blindness America where we worked to share information on the importance of screening. Through our Family Leader Network, we're able to disseminate this information to families, and this strategy is often useful to partners who have information and need it to get into the hands of families. So what we've done to help facilitate this is work with the partner and then develop a media toolkit based on their information that will help a family leader disseminate that information. So scrolling down, we put together sample newsletter articles, resources, Facebook postings and Twitter messages, as well as print materials and posters, which are convenient for clinics or pediatric practices or even community events. And finally, we put together web buttons that family leaders can post on their website to attract families who come to their website to learning more about whatever the partner's message is. I'm going back up now. And one more entry under activities I want to show is the Family-Centered Care Assessment. This is a 24-page scientifically empirical questionnaire that Family Voices has developed, and we're currently working with the American Academy of Pediatrics to field test this questionnaire. If you have an interest in the questionnaire, this is where we have the button to request to use that Family-Centered Care Assessment tool. I'm just going to show you something down below. Prior to developing the 24 questions, we developed self-assessment tools for a family to use or a provider to use that basically walked a person through different aspects of thinking about or planning family-centered care. And you're welcome to download these tools to learn more about family-centered care. Oops. So going up, we have a Tools and Resources section. And under Tools and Resources, we have our Affordable Care Act Resource Center. And as mentioned during the presentation, it provides a variety of materials, including the upcoming calls and webinars where we post up-to-date information about free webinars that you can join to learn about the ACA. We also have recordings of some past webinars, and this first one I'll just highlight because someone asked about information in different languages. There's this webinar, Healthcare Law and You, which is put together by HHS and is available in Chinese, Korean, Vietnamese, and those other languages. Another part of the ACA Resource Center is our blog, and these are monthly postings of information relevant to families, such as now that enrollment is coming, what resources are available. And you can click on the blog to both read the article and also download it as a tip sheet. These come out monthly, and one thing that we have done for the family-to-family centers and state affiliate organizations is send this out as a Word document that a family leader can then brand as their own or excerpt parts of it for a Facebook posting or a newsletter article. And we hope you'll work with PIP if you're part of the Family Voices of California F2F to get those materials every month.
Peggy, can I interrupt? There is a question about can anybody post a blog on the site, or if somebody wants to write a blog, how can they get it up here?
The blog is written by Lauren Agaratis of SPAN of New Jersey, the F2F in New Jersey, and so she is the only author that we have at this time. You can post, anyone can post comments to one of the blog entries. I think if somebody has an interest in writing a blog and it's appropriate for, you know, the national level that we have as this website, I think we'd very much be interested in talking to someone who is willing to author.
That's great to know. And then can I just follow up, since we're on the blog part of it, there's another question. When your website posts new blogs, does that information, when you've posted a new one, does that get added to your Washington, D.C. update newsletter? I mean, how do people keep up with when new blogs are being posted?
Every Washington, D.C. update may not specifically mention this blog's title, because the Washington update comes out every week. The blog comes out once a month. The Washington, D.C. update every week says, don't forget to check out the ACA Resource Center and blog. So there is a link in that update every week, but it probably doesn't specifically mention the blog title.
Okay. Okay, thank you.
Okay. I'm going to go to a section called All Tools and Resources, which basically takes all the resources that we have and on this page categorizes them by topic. So for example, if you clicked on Family Leadership Development, it's going to come up with 50 resources, and you can use the filter box to refine that search. If you don't find something within a category, there is a search box that will search the website for anything. And we also have an ability through Google to search all of the F2F websites. So if you were working on an initiative to do, say, with transition, you could enter that search term in there, and it will pop up with all the hits on the F2F website. You might be able to learn more about that. We do talk about our various partners. I'm not going to go into that. We have a section on quality health care, and I'm just going to click one of these, Family Professional Partnerships. this section of our website is really designed to help somebody new learn about, what are partnerships, why are they important, how do they work, why do they improve care. It's really written at a 101 level. But if you have new staff or new family who is ready to become a family leader, they might find those pages helpful. And I think that's probably it for the National Center website. So if there are no questions, I think we'll take a look at the Impact website.
There are, just before we leave that, there were a couple of questions from one of our attendees saying, in addition to the written materials around, advocacy, parents becoming advocates, does the National Center provide in-person trainings for parents to become better advocates?
Deb, do you want to take that question?
Sure. So the question is whether we have trainings for families who are interested in becoming advocates. Did I understand that correctly?
Yes.
Yes. So what we provide primarily are trainings and supports to the family leaders in the states. We don't have a specific training at this moment for families to become advocates. We have a number of resources that I think could be useful, but we don't have a specific training curriculum for that. We are, however, in the process of developing a curriculum that will be available to the family leaders in the states around family-centered care and family professional partnership. So that will be available to train the trainer curriculum that family leaders can use, and they can use that in part or in whole. So they may already have a training on family professional partnership, which is one part really of advocacy, and they may be able to use parts of that in their own training, or if they're a newer, younger organization, they could take the training and use that in whole. So it's really the supports that we provide to the family leaders in the states, and so that they can better provide those trainings.
Deb, can I add to that?
Oh, absolutely.
I think you're leading that project, but I think as part of that project, we have solicited a number of curriculum materials from individual F2Fs, and we will be posting those as part of that curriculum area. Is that right?
Yes.
Okay.
That is the plan.
Yeah,
Thank
like
you.
we do at Family Voices of California has a wonderful advocate training program for parents called Project Leadership, and I believe that curriculum is going to be replicable around the states very soon. We're just coming out of the pilot plan of it, and it's fabulous. So I have one other question before we leave this website from an attendee. She says, or he says, I get lost in the acronym language that's used on the website. Is there a cheat sheet somewhere on your website, a list of all the acronyms used? This is especially important for families who visit your site.
Well, that's a great question. We do have an acronym sheet on healthcare terminology. I'll get to it here.
Just up one, yes.
This is available online and as a download. So, but this is really about healthcare terms. I'm just looking to see. Yes, I don't have things in there like NCFPP means National Center for Family Professional Partnerships.
You used to have something on called Alphabet Soup, if I recall.
That's right. So these are just acronyms, and then we do have an ACA glossary, which was built on Alphabet Soup, and this is available online and as a downloaded document. And again, this is really about healthcare terms, not necessarily, what does NICHQ mean or something, or what does FV stand for.
It really is a whole different language, isn't it?
Well,
yeah.
This is Beth. Could I just add something to that? I think in most places when we use an acronym on the website, like NCFDP, at the, which is the address for this website, we also spell that out. And then I think these resources that Peggy just showed are excellent for the purpose of understanding other terms that are used.
Thank you.
Okay, on to impact.
Great. Thanks, Peggy, for the guided tour. As I said before, IMPACT stands for Improving Maternal and Child Health Policies So All Children Thrive. And we're going to start on the home page. It's www.fv-impact.org. And you'll see various menu drop-downs across the top. And Peggy, if you'll scroll down a little bit so we can see a little more of the home page. In addition to the welcome note on the left, the middle column contains information and resources for families and those who serve families about various timely topics. Some, like the Pocket Guide, are Family Voices resources, and some come from other trusted organizations. And at the bottom of that column, as well as to the left, there are links to archived highlights as well. The right-hand column highlights some of our resources and includes a link to subscribe to 3 Family Voices newsletters, and then also includes some additional news from our professional partners. And Peggy, if you go back up to the menu bar across the top and click on Wellness Themes. Okay, these health and wellness themes are the health promotion themes from the American Academy of Pediatrics Bright Futures Initiative. The links in the sidebar to the left will take you to more information on each topic. So let's click on child development. Here you'll see background information, information on ages and stages, and suggestions for what families can do to promote healthy child development. And note that the content in these sections comes directly from the Family Pocket Guide. The right-hand column includes resources related to the topic, and the sidebar on the left includes direct links to other themes. And let's go back up to the menu bar and click on the lifespan topic. Each of the 4 age stages from Bright Futures has its own section: infancy, early childhood, middle childhood, and adolescence. And again, this content is taken directly from the Family Pocket Guide. Let's click on infancy. Here you'll see an overview of the age in the main column, and then the sidebar has links on infancy-specific health promotion theme information and information about what to expect at each of the recommended well visit checkups. So let's click on the 1-month visit. Here you'll see information on preparing for the visit, things your child may be able to do at this age, and the visit priorities that the healthcare provider will likely bring up. But notice that the family's questions and concerns are always the #1 priority. So let's go back up to the top menu and look at impact products. These are the family-friendly resources created by the Impact Project. In addition to the links to the Pocket Guide and other helpful resources, you'll see a link to the wellness themes, and let's click on that.
And where is that, Melissa? Right there.
Right there, at the bottom. Click on that. Great. Okay, and this brings us to the list of all the Impact on Health and Wellness one-pagers sorted by the Bright Futures Health Promotion themes. So Peggy, if you can click on the Child Development Update for November 2013, you can see an example of one of these resources. And they're in PDFs that you can download and share with families. Okay, back to the top menu bar. Let's click on Resources. This brings us to the many resources, again found in the Pocket Guide, and they're sorted by topic. And let's click on the Special Healthcare Needs. And here you'll see an overview of the topic, and down towards the bottom, if you scroll down, We have important resources. So that's a quick run through of the Impact website. We encourage you to take some time to explore the resources on this website and use them with the families you support or in your own family as well. And I'll turn it over to Bev for the CASA tour. Thanks a lot.
Before we start the CASA, were there any questions, Pip, for the Impact?
No, none that have come in.
Okay. So let's do a quick tour of CASA. So CASA is Kids as Self-Advocates. This is the home page of our CASA website. In the top there, you'll see a picture of the board members at the last strategic planning meeting, which was 2 years ago and held in D.C. Over on the right-hand side, the tips that we shared earlier, the tip sheets, that we shared earlier on the slide are available or are displayed here. The tips for flying, going to college, and online dating. And on the bottom right, scrolling down a little bit, is the Youth Leadership Guide on Boards and Committees. And this is now set up so you can download that right here or order a copy. All right, let's go back up to the bar at the top and click on Youth Resources. So I mentioned earlier that there are a number of tip sheets available on a variety of topics. Here are the topics listed. And let's open up one of these. Let's open up civil rights and advocacy, the top topic. So here is this page has reports. It's described as real life stories told by youth and young adults with disabilities. And so any of these can be opened, and you'll have available a downloadable tip sheet. And if you scroll down to the bottom, you'll see links to other organizations and agencies that can provide information on the topic of civil rights and advocacy. Great. Let's go back up to the top and check out another tab. So, so under Youth Resources, there's many tip sheets that can be found. Now let's go to What's New tab. Here you'll find additional information sheets and youth-created guides. These also can be accessed under the Youth Resources page that we were just on. And lastly, I wanted to share one other tab, this final tab here under Articles. These are articles or stories written by youth, by CASA members, that share a personal story or circumstance. And I think you'll find some of these stories very compelling. So this concludes our website tour and our formal presentation. Pip, do we have any other questions? It looks like we have a few remaining minutes here, and I wonder if we have any other questions that people have presented to you, or if you're going to open up the lines.
I can open up the lines. If anybody would like to raise their hand, or I can unmute you, on your little icon you've got a hand, you can put that up, or if you would like to send me a note, I can unmute you and you can speak to our presenters. I think, no? That was a very thorough overview of your websites. Thank you so much, Peggy, Bev, and Melissa. So as I said, this will be available on the National Family Voices website as well as Family Voices California, so it can be revisited anytime. And I think that we can probably close the webinar for today. My sincere thanks to all of you for joining us, and I hope everybody has a wonderful day. Bye-bye.
Thank you.
Thanks.
Bye-bye.